All right, so we're going to do the shoulder and the upper limb. This bone right here is the scapula, and this is the clavicle. Goes like this. And this bone is the humerus. This bone is the ulnar and radius. Those are the two bones of the forearm. How to know them? Just look at this circle right here and remember the radius of the circle. So you see this circle and this bone, you know that this is a radius. So ulnar and radius. But you're going to start with the scapula. You have two surfaces. This one right here is flat and it looks like a concave structure. So this is the subscapular fossa. If you look on the other side, you see a spine, the scapular spine, and there's a fossa above or superior, and there's one inferior. So the fossa that's superior to the spine is supraspinous fossa. The fossa that's inferior to the spine, infraspinous fossa. You have two fossae. If you follow the spine, you will go to this process right here, which is called the acromion. So the continuation of the spine is called the acromion. And right here you see another one. So you see two processes here. This is the acromion, and this is called the coracoid process. This is called the glenoid cavity, which is a cavity that's going to articulate with the humerus like this, with the head of the humerus. Glenoid cavity, right here, articulate with the head of the humerus. As you see, this looks like a triangle, and you have 1, 2 angles, superior and inferior angles, and this one doesn't look like an angle. This is where the glenoid cavity is. And you see borders. Here is upper border, and this is the medial, and this is the lateral. How did I know that this is the lateral? Because of this is the side of the glenoid cavity. So your humerus, your arm is lateral, and this part is medial. So this is for the scapula. The next one is the clavicle, and the most important thing that you need to know about this, the clavicle, is which end. This flat end right here, and this one is kind of bulky. So the one that's flat looks flat like the acromion process of the scapula, and this it goes like this. So this flat surface, flat end right here, this is called the scapular end, or the acromial end. That's going to articulate the acromion, and the other end, which is right here, this is going to articulate with the sternum. So this is the clavicle, this is the scapula. Then you have the humerus. This is the humerus. This is the head of the humerus, and you have two necks, not just one. Here is one, and here is the other one. So this is the head, this is the neck. It's called the anatomical neck, and this is called the surgical neck. Head, anatomical neck, surgical neck. And you're going to see two tubercles here. This is the greater tubercle, and this is called the lesser tubercle, and in between is tubercular groove. So greater tubercle, lesser tubercle, and the groove is right here. This is the shaft, the main part, and this is called trochlea, this part right here. Condyle, and this is called the epicondyle. You have two fossae right here. This one is anterior, and this is one the posterior, and it's going to articulate with the ulna like this. This is called the olecranon process. So this is the olecranon fossa, and the other one is going to go with the other process of the ulna. Again, this is the ulna. This is the olecranon process, and this is the notch, olecranon notch. It's going to articulate with the trochlea on the lower part of the humerus. As you go, besides knowing the bones, you need to remember the articulations as well. So like the head of the humerus articulates proximally with glenoid process of the scapula, proximally. And proximally means closer to the point of attachment. The point of attachment of the upper limb is shoulder. So proximally, the head articulates with the glenoid cavity, and distally, it's going to articulate with two bones, ulna and radius. And the ulna should be medially, the radius should be laterally. This is the head of the radius, this is the neck, and this is called, it's a tubercle on the radius, radial tubercle, or radial tuberosity, right here. And And this is the head, so it's upside down, it goes like this. This is the head and this is the neck of the ulna. If you put those two together like this, if you articulate, you see proximal radio-ulnar joint, which is the joint between the two here, yes, and this is the distal radio-ulnar joint. So radius and ulnar. Then this is the hand. These 8 bones right here, the little bones, these are called the carpal bones, and we're not going to do the different names now, but this is together, the 8 bones together collectively are known as carpal bones, followed by metacarpal bones, and then phalangeal bones. You always count from the thumb, which is the big finger, the large finger, and you start with, this is carpals again, and this is metacarpal 1, 2, 3, 4, 5. And as you see here, these are called the phalanges, phalangeal bones, and 1, 2, 3, 1, 2, 3, all of them are 3, except here, the thumb contains only 2, the middle is not there, we don't have a middle. So we have proximal, middle, and distal phalanx for 1, 2, 3, 4, 4 fingers. The thumb doesn't have the middle, so you have the proximal and distal only. Proximal and distal. So again, carpal, metacarpal, phalangeal, and you always count from here. So this is metacarpal 1, 2, 3, 4, 5, and this is the thumb 1, 2, 3, 4, 4, 5. This is the upper limb.